Reading medical papers. Daily arm ischemia boosts heart protection and blood vessel growth. Let's all read this paper together. The title of this paper is Remote Ischemic Conditioning, RIC, and Chronic Remote Ischemic Conditioning, chronic RIC. Really helpful for protecting the heart and even promoting new blood vessel growth. What is remote ischemic conditioning, RIC? Simply put, it involves temporarily blocking blood flow to the arm using a blood pressure cuff for a few minutes, then releasing it and repeating this several times. Although this causes only a brief period of ischemia, lack of blood flow, the body activates a protective mechanism that helps the heart suffer less damage when it actually encounters ischemia or a heart attack. You can think of it as a small practice drill for the body, so when real danger occurs, the response is faster and more protective. Why study this? Many small studies have found that RIC can reduce damage from heart attacks and even lower mortality rates. However, larger clinical trials have shown inconsistent results, with some patients showing little benefit. Possible reasons include older age, diabetes, hypertension, and other chronic diseases affecting the outcome. Use of certain medications, such as the anesthetic propofol, that may negate the effect. Therefore, scientists propose the idea, what if RIC is done once daily, accumulating effects over time? This is called chronic remote ischemic conditioning, chronic RIC. How is the research conducted? This study involved 11 healthy volunteers who were asked to, on the first day, undergo RIC once. Then, continue daily for a week with the chronic RIC to prepare the heart long-term. Subsequently, the researchers collected blood samples to analyze the cytokines in the plasma, which are molecules that influence immunity and blood vessel growth. The surface characteristics of monocytes, immune cells, in the blood, using this plasma to culture vascular cells to see if it could promote angiogenesis. Research findings. The results are quite intriguing. Effects of plasma. Culturing vascular cells with plasma from chronic RIC significantly increased indicators of angiogenesis. For instance, the number of vascular branches and nodes was higher than in the control group. This indicates that the plasma indeed contains some signals that promote blood vessel growth. Effects of monocytes. The culture medium of monocytes did not show a significant impact on angiogenesis. However, their surface characteristics changed. The number of Ti2 positive cells increased. These cells are related to vascular repair. The number of CCR2 positive cells decreased. These cells tend to promote inflammation. In other words, the character of immune cells shifted more towards repair rather than destruction. Changes in cytokines. Overall, the average values did not show significant differences. Yet, individual volunteers exhibited notable changes, such as significant increases in IL-1 alpha, CXCL5, and growth hormone in certain individuals. However, adding these hormones alone could not fully replicate the effects of chronic RIC plasma. This suggests that the true protective effect may result from the combined action of multiple factors. Conclusion. This study informs us that RIC and chronic RIC may promote angiogenesis and assist in heart repair through signals in the plasma. The nature of immune cells also changes, becoming more repair-oriented rather than inflammatory. The effects are not caused by a single molecule, but rather by the collaboration of multiple factors. In simpler terms, one can think of RIC as a slight daily ischemia of the arm, which prompts the body to secrete some protective signals for the heart, while also making immune cells milder and more helpful in repair. Over time, this may indeed help the heart reduce damage when faced with danger. Do people truly believe that healthy medicine and RIC can promote wellness? Hurry and purchase a healthy RIC sphygmomanometer to enhance your health every day. Don't forget to scan the QR code. Thank you all for watching. I am Dr. Andrew Shu Lee. Until next time.